Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest has not been mentioned, so we're going to take you through most of the root canal treated teeth in this CBCT. This is the panoramic view. We can see that there is bone loss around the lower right second molar. We've got a cantilever in the lower right second premolar. We've got an endo-treated upper right second premolar, and then we've got the upper left second premolar, first molar, and second molar with endo treatment and crowns. So we're going to take you through all of these teeth. On the transaxial view, which is basically the proximal view, you can see that this is the distal root of the lower right 7, and here you can see that there is significant bone loss. This is root canal treated. We've got a periapical radiolucency with bone loss on the buccal as well as the lingual aspect of the stool. When we move on to the mesial root, you can see both the mesial canals have been obturated, but we have significant bone loss, and this tooth is most likely grade 3 mobile. We've got very thick cortical plates, so implant placement needs to be done with keeping this in mind that there is no vasculature in the lower right second molar buccal cortical plate, so the implant will need to be placed more towards the lingual area so that more vasculature can be obtained. This is the lower right first molar. We don't see significant bone loss, but we do see that this tooth has a cavity on the buccal aspect which is encroaching into the nerve space, which we can see right here. So this is the cavity, and this cavity is encroaching into the nerve space. This tooth will definitely need endodontic treatment. When we move to the lower right second premolar, so this is a region where a cantilever is present, and here an implant can be placed very comfortably because we've got, sorry, my apologies. So we've got 5.8 millimeters of ridge width with 18 millimeters of ridge height. So an implant in the second premolar can be placed very comfortably in this region. When we move on to the upper left segment, the upper left segment has root canal treated. Here you can see that this tooth has a periapical radiolucency. We also feel like the metallic post is resulting in a crack situation right here, which we can see. We've got a crown present here. We've got a very big core buildup material, radio opaque material, which can be seen on the palatal aspect. But something to note is that there is definitely a radiolucency and this radio hypodense area in the tooth, which can signify a crack in the upper left second premolar. This is the upper left first molar. We've got a root canal treated tooth. You can see that this is the mesiobuccal canal. This is the parietal canal, and as we move distally, this is the distobuccal canal present right here. So this tooth has mild periapical radiolucencies, and this can be the cause of this sinusitis that we see. It's mild sinusitis. When you move on to the upper left second molar, to the here also we can see that there is a crack in the upper left second molar, which is resulting in this periapical radiolucency, which is interradicular. So this radiolucency is peculiar only because there is a very significant crack that can be seen here in the upper left second molar.